1, 2, okay. If you're online, welcome back.
Thanks.
We'll just wait for another 3 minutes before we start. To those of you who are on time. Are you getting more, Candace? Okay. You're rounding them up? Okay. Okay. We're going to start. Welcome back. Did you have a good lunch? Enjoyed your lunch? Yeah, so the last conversation before lunch, I must say, was quite juicy. In a way, so I'm looking forward to adding, to us adding to that juiciness, because it was really an interesting, fascinating conversation. I left feeling conflicted because the presentations and just the discussion made me think, there are actually not so many options for, and at the same time, we want to remain hopeful, and we want to find, new avenues to do the work that we do. So I'm going to hand over to Aadielah, because she had already started to say, hey, we need to know where to from here. And she's going to focus her presentation, and will be all ears, Aadielah, I can tell you that, on how can health taxes fill the gap. And, you can build whichever way you want from the previous conversations for the sake of continuity and just bringing more insight. And then we can open this discussion up to where to from here. After Aadielah's presentation and the conversation we're going to have about where to from here, we're going to ask Wiseman Makasela to just, also talk about what are some of the key takeaways from these conversations that he has identified, adding to the conversation around where to from here. And we will end with Mapalane Mfundisi, who will close us out. So over to you, Aadielah.
Thank you. And I hope you all enjoyed the conversation that went with lunch. I'm going to talk about, I've been asked to talk about health taxes, and this is not my own work, but rather it draws on a resource that I think that would be useful for everybody to read, that was produced by Vital Strategies. Next slide, please. So I start the conversation by saying that SAAPA, the Southern African Alcohol Policy Alliance, essentially have embraced the issue of increased excise tax on alcohol. And this is because, and I think the previous moderator left the room flabbergasted by the cost of our debt or servicing our debt. The cost of alcohol harm to country annually is between 10 and 12% of GDP. Last year, that worked out to 800 billion rand. We lose 100 people every day due to alcohol-related harm. And this harm spans across health and social harms. So I'm not going to go into detail to that, but that's the background. So 2 weeks ago, a week before budget speech, we marched onto Parliament asking government to increase the excise tax on alcohol. And we used the issue of bread and beer. A lot of people don't know this, but beer is cheaper than bread in this country. And I hope in the room I'm getting people to go and Google, because that's often the response, is that really true? But that is the truth of the matter. Next slide, please. So I'm just going to very briefly reflect, and as I indicated earlier on, that most of the issues that I wanted to talk about and raise was already discussed in the sessions in the morning. Next slide, please. But I think a key issue that we need to come to terms with, is that we should refrain using the word sin tax. That excise tax, or as we would like to frame health tax, is a tax that's a tool available to all governments. Next slide, please, so I can just talk to that. It's available to all governments, 1, to protect and promote public health, and 2, to generate sustainable revenue. That the notion of, or the very, at the heart of excise tax, is that it acknowledges the disproportionate harm of products like tobacco, alcohol, and sugar-sweetened beverages. And that the purpose is to help correct market failures by ensuring that the broader social and economic costs of disease, disability, loss of productivity are reflected in product prices and thus promote equity. I think Salome very specifically asked us, and I think Mohammed also, the issue around what does equity mean for us? And we see health tax as one way of beginning to address that. Next slide, please. So what's the health tax proposition? That if you increase tax, you will have higher prices, you will lower consumption, and therefore you will get better health. Next slide, please. And the key thing, and I think earlier on, the question was, what evidence do we need to put forward to Treasury to begin to engage and shift the conversation? And the key issue is that for us to win the issue around taxing or health for tax, tax for health, sorry, is that we need to put to forefront the health rationale, that we constantly need to use evidence available to us. Next slide, please. And we have that evidence available to us. We've got burden of disease stats, we've got healthcare costs, we've got productivity loss costs, we've got deaths, and we have information on the potential deaths that could be averted and disease burden that could be reduced if we looked at tax as one of the potential ways of reducing the burden on the country. And there has been several studies, different people, the SAMRC, the UCT REAP, economics unit, Rashad has been involved in some studies that we need to use to make the argument for health taxes. Next slide, please. It requires modeling, and again, I mean, this is not what is not our work, or what I'm reflecting is what we require to do in order to use health tax as an instrument for addressing health equity. And we are able to gain several things by looking at modeling as one way of gaining evidence. Next slide, please. I'm not going to go into it because it's been discussed in the room. And there's different ways in which that could be done. Next slide, please. Well, I think that's, for us, the key issue is that we constantly have industry arguing against health tax, excise tax. The louder they shout about excise tax, the more comfort we should gain by the fact that we're on the right track. It makes them uncomfortable because, next slide, please. Because what health tax does, it's a direct threat to their profit margin. That health taxes increases prices, it reduces consumption, it can contribute to reducing consumption, and therefore sales, and therefore is a threat to their profit margin. Next slide, please. But there's a playbook that the industry uses, and we've seen this across tobacco, alcohol, sugar, sweetened beverages, that they use to argue against health taxes. One, they question science, and they introduce their own pseudoscience into the narrative. They undermine, particularly the World Health Organization's recommendations, that they push for voluntary guidelines, that they don't want to be regulated. And I think that we need to, for us in working the alcohol space, this is a particular issue that the industry continuously push back against any regulation that, again, reflecting on our alcohol experience, is that they blame the consumers. That, and I'm sure all of you have been exposed to the advertising that pushes responsible drinking narrative. What that does, it places the emphasis on the individual to take responsibility for their own behavior, rather than looking at what are some of the structural issues that needs to be addressed to impact on the choices people make around drinking. During COVID, we saw them using lawsuits in particular. They deploy front groups. And I think for all of you working on NCDs, that they do pretend they are not targeting children. And that the biggest issue is that they push the job loss narrative, that if we increase taxes, it will impact on jobs, that they would have to make choices. But that very job loss argument is never acknowledged when they make their own internal decisions, when they introduce a mechanization as an example. Next slide, please. Sorry. Oh, I sent you the wrong slide. Show. So what, do you mind if I share from my side?
Go ahead, it's fine.
Okay. There's a few slides missing. Let me just do this. You're able to see?
Yes, yes, we do. We can see. Yeah.
I need to go to.
Yeah. If you can please put it on presentation mode, that will be helpful.
You can see that?
Yeah.
So as SAAPA, we, as I said, we decided to promote the idea of increased excise tax as an important tool to government to address the harms of alcohol in the country. This is a image that we have using that our country and our roads are being flooded by alcohol, just based on our understanding of the statistics and the conversations we have with communities. As I said, we use the analogy between the cost of bread versus that of alcohol. And I hope this will spark some conversation in the room. The key thing, and I think I really appreciated Muhammad's emphasis on community and community participation, is that we have entered into partnerships with communities through, as well as we have decided to have a partnership with the National House of Traditional and Khoisan Leaders. They currently represent about 1/3 of our population. And I think it is an underutilized partnership that we've used in the health sector to begin to address issues that affects communities in all over the country, but also particularly in rural communities. In our process, we, in advocating for increased excise tax on alcohol, we targeted policymakers. And so we had something what we called message in the bottle, where we put in facts on alcohol harm, and we did a survey around what's the perception of taxes amongst just over 1,000 people in South Africa, and what they would support. As all campaigns, we identify champions, and that we are engaging with committees, the different parliamentary committees on this issue. And then we have looked at media. And I think the one under-resourced media tool that we've not really used is that of sponsored media. We see the alcohol industry use that all the time. And the thing about sponsored media is that you can't have anybody writing an objection to it. And so we've very specifically included that in our strategy to put things on the table with regards to alcohol and alcohol harm. And we've done this across different media. We've had several, we don't have to talk about this, but we've used different media platforms, from traditional to social media, radio. I know that in the room you have Lucille from CMT, and we worked with for our campaign. We have engaged social influencers in promoting this issue around using taxation for health.
You are breaking. I think our connection is not that good. So just so you know, we are missing a few words. I don't know if you can hear us.
I can hear you, and apologies if there is some connectivity issues.
Yeah,
But,
the last word we heard from you was around using influencers.
I think for us, part of the lesson is that you have to put that into the mix of any campaign. You have to be careful about how you use influencers and how you select them. And they need to align to your own Hanifa. So you have to be careful about alignment.